Well, welcome back to part two of our discussion on mental health topics. This is a required discussion that we have to have at the beginning of each school year on the topic of suicide prevention and what, as staff members, is our role here. So, one of the things that we always need to remember is that we may oftentimes see students more than their parents or more than maybe even siblings or friends. So, it's super important that we help students feel connected here at school. So, what do we do? What do we look for? Those are things that we need to always keep in mind. Now, the topic of suicide, in a big point here, is that it's preventable. And we also need to accept that suicidal thoughts are actually a normal human thought process. It's not that people never think about suicide, or if the thought of it that is initially uh, going to lead to it happening. Uh, the problem here is that it's somebody who is suffering a lot of pain, whether it's emotional, usually emotional, can be physical. And it's not that a person who's suicidal actually wants to die. It's typically that they're trying to figure out how to get that pain to stop and they can't find any other method. So we need to recognize when somebody's really hurting and find ways to intervene. And for Hermantown and our community schools here, we've been very fortunate, one, that we've got great staff members, that we have people who care and pay attention to that and are very alert to that and are willing to intervene. And we need to recognize too, though, that we're not immune. Okay, we've been very fortunate in 20 plus years. We've not had a suicide of a current student. We have had multiple students attempt, and we have had in recent years multiple students who had graduated committed suicide several years after graduating from school here. We've also had several parents who had committed suicide within the community. So we are not immune to this. Every other community around us has gone through that tragedy of a current student. And it's one thing that we haven't had happen again. A little bit lucky, but also comes back to our staff building relationships with kids and having that level of trust where they're willing to either come tell us about either themselves or somebody that they know. But the other part of saying that we are not immune is also recognizing that this applies to adults, like I just mentioned. There have been parents in the community who have committed suicide, and we need to also keep an eye and use these same ideas and keep an eye on each other. So school connectedness is that belief by students that adults or peers in the school care about them as individuals, that they are not just some person or some warm body in a chair moving around the building, that they're actually seen and known. And when a suicide does happen, sometimes it's able to be tracked back and found that that student had that lack of connection to their school community. Now, one of the things that we see when we survey either our own survey at the end of the school year or the Minnesota State Student Survey is that nearly 100% of our students report feeling safe at school. That's pretty amazing. And well over 90% report saying they have an overall positive experience here. And again, that goes back to you. You know, you are the ones who create that environment. You are the ones who address, when somebody's doing something they shouldn't do, you're the one who addresses it. But you are also the people out there making those connections with kids, whether it is teachers or paraprofessionals or in the office or coaches after school or advisors for other programming. It's just super important to be making those connections with kids. It's what makes the difference here. So how can we as educators increase school connectedness? Well, first of all, you're already doing an excellent job at that. And there's 6 points here, and obviously the number 6 is the one bolded and the most important here, but just to run through the others. Number 1 is involving student and family in, which Hermantown is pretty amazing in that regard. There's no downtown. The hub of the community is the school district. So number 2 is providing education opportunities for children's academic and school life. So, we have so many opportunities for a district our size. Again, pretty amazing. Number 3, provide students with the academic, emotional, and social skills. Think about our DBT training. We do that with staff, but we also do that at all 3 building levels, elementary, middle, and high school. Number 4 is use effective classroom management and teaching methods. Create that positive environment, which is something that you already do. Number 5, provide professional development. So we do that with our DBT, but we're also doing that with this presentation here. And then number 6, it's all about trust, creating that trusting and caring relationship that promotes open communication. The biggest way we can prevent a tragedy from happening is to have that rapport built with kids where they will come and tell us so that we can intervene. So what to look for, and before I go through this list, the biggest thing we'll say here is this: trust your gut feeling. If you have a gut feeling and you just feel like something isn't right, trust it. Come and tell the counselors so that we can help follow up and intervene. Some of those things that might trigger that gut feeling, what to look for: avoidance, whether it's friends, activities, or school. The second thing is somebody who gets stuck in that cycle and can't get out of a thought pattern and really focusing on a problem. Number 3 is an unexpected outburst of emotion. Number 4, anything that really disrupts sleeping patterns. It might be not able to sleep, but it also might be sleeping constantly to try and avoid what's going on in a person's life. So number 5, a change in eating pattern or significant weight gain or weight loss. Number 6 is a significant change in body image, might include scratching or cutting. 7 is, again, that daydreaming kind of behavior to avoid what's going on around a person. And number 8 is that severe change in behavior, and oftentimes that includes excessive use of drugs or alcohol. So what to do if you are concerned? Reach out to the student, have that conversation. Listen without judging, use those DBT skills and validate how a person is feeling. Don't be afraid to ask them the tough questions. But with that, if you are at that place in the discussion where you're willing to ask tough questions, that's also that time that you need to make sure the next thing you do is that you are getting them to go speak with somebody else, or you are going to the counselor or the social worker or the school nurse or your administrator and letting them know that you think that there is a significant risk and that we need to look at intervening. Make sure that you can continue to stay connected with that student. That relationship keeps on going, and it's really important to do that. And again, it takes all of us. So stay in touch with mental health staff, but it takes all of us to keep an eye out for our students. So in summary, the first thing I'll say is keep doing what you're doing. We know that we have a really good environment, but we also know that tragedies can happen and that we are not immune. So help students feel connected, observe and listen, use those DBT skills. Don't be afraid to ask the tough questions, and make sure that we work as a team, that we are all on board looking out for our kids. So share concerns with your building mental health people. So again, thanks for what you do, and thanks for all we know that you're going to do this year. And we'll end this discussion just with a couple of resources on this last slide.